At the end of it, we'll be disseminating national guidelines on workplace, on mental wellness, and the target group are our staff and other people who are working, because we've realized mental health has been a very big concern. It's something that had been ignored, but then we want to address it now, because according to our statistics, there are many people at their place of work who are affected for various challenges, socio-economical, substance abuse, excess consumption of alcohol. So these are the issues that we want to address. And we are starting today, and there will be activities that will be ongoing until the 9th. So there are some areas that we need to address. So we want to make it, is it like home-based? In Baringo County, we know our county, and we know where those challenges are, and we know what needs to be required.
The theme for this year is it's time to prioritize mental health in the workplace. And our government has developed a mental health workplace guidelines policy document that is actually going to guide us on what we need to do in our workplaces. And there are three key approaches in the guideline. One is the promotive approaches, where we invest on efforts to ensure that employees or individuals in the workplace have better capacity to take control of their mental health. So there's a whole approach focusing on promotive. And then also there's the preventive approach, where we're looking at the workplace. The workplace can help us to have better mental health, but at the same time, it can make us vulnerable. So again, that second component looks at some of the preventive aspects that we need to put in place in our workplace to ensure that we make it easier for our staff to enjoy good mental health. And then the third component is actually on self-care, which looks at what an individual needs to do. Because there's a lot that you can do actually as an individual to promote your mental well-being. One of the key outputs of that dissemination is to ensure that in every workplace within Baringo County, we have the right environment that promotes mental wellness. It has been found that we spent close to 60% of our time in the workplace. And that means a lot. The workplace can help us to have better mental health in terms of giving us an income, giving us a sense of identity. But at the same time, if it's not well handled well, then it can give us a challenge. So in line with the approach by our government, where we're investing more in preventive, so you'll realize that in this series of activities, we'll actually focus a lot on preventing mental health conditions. At the same time, we also put in place measures to take care of those who are affected.
Previously, we have focused on physical health, we have focused on all other aspects of health and forgotten mental health. And statistics show that there's a lot of burnout and a lot of stress, anxiety, depression, and that is associated with interaction at the workplace, and not to mention substance use disorders. The prevalence of burnout among healthcare workers was shown to be at 66%. That is quite high. So annually we are seeing more patients coming with burnout coming from work, their workstations, and that leads them to either going into depression, leads them to going into substance abuse, leads them to developing anxiety. And that is why we are really focusing this year on saying that mental wellness is important as at workplaces. In as much as workplaces are focusing on output, they also need to invest on the input. They need to invest on the employees who are now the workforce. For the workforce to be productive and to give output, mental wellness of these workers has to be emphasized.